The Care Crisis, an interview with disability activist Lauren Perry. According to data published for leading disability charity Scope, there are 14.6 million disabled people living in the UK, many of whom are in receipt of care known as direct payments. I had the opportunity to speak to Lauren, a 22-year-old living in Brighton, who is chronically ill and disabled, to find out her experiences in accessing appropriate care.
Hi, my name's Lauren and I'm in receipt of direct payments through Brighton Hove Council. I'm also known as A Ticker's Guide to Life on social media, and I've got a blog and run a disability group here in Brighton. I've been in receipt of care now since 2018. I've got to know loads of amazing disabled people living in Brighton over the last few years. Some of those receive care or are struggling to try and access care within the community.
The care system has been at a crisis point for a number of years, with the COVID-19 pandemic only making it worse. Millions of disabled people nationwide are struggling to access the help and support they require, which in turn means they can't live independently. With a huge shortage of carers, disabled people are often left to struggle on their own. I asked Lauren to explain what the main differences are between a carer and a PA.
The main difference between a PA and a carer is the way in which you are supported. With care, a lot of the time, care agencies see lots of different clients in a day. They might pop in and out. PA, it's very personal and it kind of becomes like a professional friendship. Me and my PAs have always been really good friends, but they understand that I am their employer. Whereas with carers, it can be more clinical based. I do use the word PA and carer interchangeably, mainly because my PAs do clinical and personal care stuff too. But when out and about in public, they don't wear a uniform, and I kind of introduce them as my friend. Lots of people have preconceived ideas about disability, and I think when you become a PA, you realise that we're just like anybody else.
Lauren experienced a large period of time with little to no care, isolating her from the community and causing her health and happiness to decline. She tried to advertise for a PA herself on multiple occasions but had no luck. Ultimately, this led to her intermitting her university degree.
Life without care was incredibly challenging. I was constantly battling with the council to get my care hours increased, as well as the pay for my carers, as I simply couldn't find a carer with such low pay. Often the council have a one-size-fits-all policy when it comes to care. In the past, I've really struggled to get my care funding budget increased. Lots of people qualify for care for loads of different reasons. As a young person trying to access university, I sort of fell between the gap between university providing support and the council's providing support. Trying to employ carers for minimum wage is frankly embarrassing. I would put adverts out everywhere, on local job boards, Facebook, and I'd be posting constantly, and it'd get to the point where I'd be so embarrassed when people were commenting saying I'd do it if the pay wasn't so low. I really wish that the pay was so much higher.
In a survey carried out in March of 2022 for Skills for Care, it was found that a large percentage of PAs had not been trained properly. This is due to the lack of funding and low regard for disabled people's welfare. Some service users have been left feeling unsafe in the hands of untrained PAs, particularly those who have medical devices.
Having your life literally in the hands of other people can be terrifying, and knowing that they're not trained is even worse. Basic first aid for carers should just be mandatory.
Lauren told me she has recently managed to employ a PA after an incredibly long time without appropriate care. Things are starting to feel more positive for her, but she is incredibly aware of the millions of people still waiting to receive support. It took her 4 years to obtain a satisfactory care package. She said she's worried about many members of her disability group and how long it may take for them to receive the same help.
Battling with the council for many years, I finally managed to get to a place where they had agreed for me to have a care package that suited my needs. I am now in a place where I have got a PA. She's incredible, but I did not source her through council. I found her through an independent source. Being able to pay my PAs higher wages, it means that the quality of care is so much better. we're able to do so much more.
Having also spoken with a focus group of disabled and chronically ill people in Brighton, with the majority wishing to remain anonymous, key themes arose on what they feel need to change within the direct payment system. These are as follows. The PA pay rate needs to be increased, easier access to funding, reliable carer agencies, local support for carers, adequate training for carers, somewhere for the jobs to be advertised and promoted better, and the retention of employees.
It would be great if the council started taking a more individualised approach in line with the Care Act 2014 when considering care plans, particularly for young people. All disabled people and chronically ill people fit into the same mould. As a PA, you might be able to support us to live independent lives. It doesn't mean you do things for us, it means you help us to do things to be able to achieve what we want to achieve, whether that's to work, to enter education, or just simply go out with our friends.
The Brighton and Hove Direct Payments team have sent a survey to those in receipt of direct payments, asking for responses for a report on behalf of the independent body Health Watch England. They are asking for feedback in order to better the experience of service users. Lauren said that this is promising to have received this survey, and interestingly, many of the key themes that the council have proposed as improvements align with comments that she receives regularly from members of her disability group. Lauren tells me she looks forward to new strategies being implemented now that these issues have been highlighted.